Well, students, how are you all? Today we are going to see about giving sarcoma. It is one of the major conditions in which the entire bone will be affected. Let us see a small introduction about this Ewing sarcoma. It is a rare type of bone cancer. Mainly, it affects children and the young adults. It is highly aggressive cancer that can spread quickly to other parts of the body. It can easily metastasize to other parts of the body. Here, we'll see about the etiology, pathophysiology, clinical manifestations, diagnostic findings, medical and surgical management, including nursing management, prognosis, and the follow-up. First of all, what is the definition of Ewing sarcoma? Ewing sarcoma is a rare type of cancer. It mostly what form? It is a rare type of cancer that mainly occurs in the bones or in the soft tissue around the bones. The bones which are covered by the soft tissue, it is mainly affected. Mainly three types of Ewing sarcoma commonly found. Ewing sarcoma of bone is the most common type of this condition. Second one, extraosseous Ewing tumor means the bone which is covered by the different tissues, which is connected to the different tissues, it is easily affected. Extraosseous Ewing tumors are the tumors in the soft tissues like muscles, tendons, and ligaments, which surrounds the bones. Third one, peripheral primitive neuroectodermal tumor. It also starts in the bone or the soft tissue, but it has slightly different genetic makeup than the Ewing sarcoma. These are all main three types of Ewing sarcoma. Next, etiology and the risk factors. The main etiology is unknown till now, but mainly it arises from the bone marrow, that it mainly constitutes of abnormal growth of the immature nerve tissue cells. Wherever there is a abnormal growth takes place, this Ewing sarcoma will be seen. According to the research studies, they mainly said that it is the result of the genetic mutations or the chromosomal abnormalities. During the fetal development, if any chromosomal abnormalities are detected or any changes in the genes, it ultimately results in the Ewing sarcoma. Some of the contributing factors which leads to the development of Ewing sarcoma include age, gender, race, and the family history. In case of age, it mainly seen in children and the young adults between the ages of 10 and 20. This Ewing sarcoma is most commonly found in the ages between the 10 and 20. In case of gender, it is more common in males. It will be less seen in the females. Coming to the race, it is most commonly seen in Caucasians. Family history, there may be genetic predisposition to develop the Ewing sarcoma. It is not clearly stated that the Ewing sarcoma will be developed through the genetics, but if any chromosomal abnormalities takes place during the fetal development, that ultimately leads in the Ewing sarcoma. Main pathophysiology, it is a rare malignant tumor that arises from the bone or soft tissue, and it will be seen like a presence of small, round, and blue cells. It is characterized by the presence of small, round, and the blue cells. But what is the exact reason? We don't know up to now. It mainly involves in the fusion of two genes. Here, in this patho of Ewing sarcoma, we will see that the genes named EWSR1 and FLI1, it results in the production of abnormal protein called EWS FL1 FLA1. This protein plays a key role mainly in the growth of the cancer cells. Thus, the abnormality in the EWS FLI1 protein binds to the specific genes in the DNA of cancer cells, it leads to the changes in the gene expression that ultimately results in promoting the cell growth and division. There will be the abnormality seen in the cell growth and the division. There will be more proliferation. Thus, formation of the new blood vessels, which helps to supply the nutrients and oxygen to the growing tumor. Here, this is a complex and it involves the interaction between the cancer cells and the immune system. But more research is going on in order to understand this mechanism and how the development of this disease takes place. But the ultimate result is unknown. What are the main signs and symptoms will be observed in this Ewing sarcoma? Pain and swelling, fever, fatigue, weight loss, and bone fractures. Pain will be mostly seen in the affected area, and swelling also will be observed. Fever, if the tumors are larger and the metastasis is more, fever always present. Fatigue. Due to the cancer effect on the body, if the treatment is used to manage it also, the patient may experience the fatigue. Weight loss will occur due to the decreased appetite. Due to the increased production of cell growth and development, the appetite will be decreased. So, ultimately, the patient will have the weight loss. Bone fractures. Due to the weakening of the bone by the tumor, it results in the bone fractures. So, next we will see about the diagnostic findings. The main imaging studies by X-ray, CT scan, MRI scan and PET scan, we can identify the tumor. Where was the tumor located? What was the size, the location and the extent of spread? Means the metastasis we can able to identify. Whereas in biopsy, we can confirm the diagnosis of Ewing sarcoma. Here, what we will see, if the small sample of tissue is removed from the tumor and we will observe under the microscopy, the cancer cells are present. It also provides the grading and type of the tumor so that we can give the treatment. Whereas Ewing sarcoma, it involves a multidisciplinary approach, like based on the size and condition of the tumor, the metastasis, it mainly differentiated into chemotherapy, radiation therapy and surgery. Mainly, the chemotherapy involves vincristine, doxorubicin, cyclophosphamide and ifosfamide. Whereas the radiation therapy, it is the combination with chemotherapy and the surgery. Because in order to perform the surgery, first of all, we need to give some radiation so that the tumor will be shrunk. And after surgery, if any remaining cancer cells are present, the radiation therapy will help to relieve that pain, and what are the other symptoms caused by the tumor, it helps to reduce that. Surgical management. The surgical management involves the removing of the tumor nearby lymph nodes or affected bone. In some of the cases, the whole part which was affected with that sarcoma, it must be completely removed. That means amputation may be necessary in some of the situations. Limb sparing surgery. Whereas in case of Ewing sarcoma in the extremities, it is a common approach. Here, what happens means, in case of limb sparing surgery, the removing of the tumor at a margin of healthy tissue, followed by reconstruction of the affected area. By using some of the bone grafts or prosthetic devices, we will try to reconstruct the affected area. That is limb sparing surgery. When we will go for amputation, If the limb sparing surgery is not possible, or if after performing the limb sparing surgery, the good outcome, if won't come the if the outcome was not good, we'll go for the amputation. This amputation involves whatever the affected limb was there, we will remove that area and surrounding tissues also. Because the cancer spread the surrounding tissue and it causes the metastasis. So we will remove the affected area and the surrounding tissue so that further spread may be increased. Finally, nursing management. In case of nursing sarcoma, in case of Ewing sarcoma, nursing management plays a crucial role. Here, we can provide the comprehensive care to the patient and their family, including the education, support, and coordination of care. We need to educate the patient regarding the condition, what is the management facilities available regarding this condition, and the psychological support and the spiritual support. Assessment and monitoring. In case of the sarcoma, nurses should monitor the vital signs, pain level, and symptoms of infection. Here, we need to assess the patient's emotional and psychological needs and need to provide the psychological support as and when needed. Excuse me. Next, pain management. Here, in case of patient pain level and appropriate pain relief measures we need to provide, such as with the help of prescription of doctor, we need to administer some medications and non-pharmacological interventions like relaxation techniques and distraction therapy, like listening to music or doing some work like that. We need to divert them. Next, wound care. In case of patient undergoing surgery, like limb sparing surgery and amputation, nurse should assess and monitor the patient surgical, observe for any sign of infections or any complications like that. She need to provide the wound care such as the dressing changes and the wound irrigation. Next, psychosocial support. They may experience the severe distress and they may not be able to participate in the daily activities, and they may feel severe stress. So in case of that, we need to understand their concerns and we need to provide the psychosocial support like counseling and referral to the support groups or mental health professionals whenever they need it. We need to continuously observe for their psychological capacity and their activities, whether they are performing, whether they are mingling with their family members and they are doing their activities or not. We need to observe them and we need to provide according to the strategy. Prognosis and follow-up. Here, the prognosis mainly depends on the stage of the disease. After diagnosis, the size and location of the tumor, the patient's age, and the overall health. Here, the survival rate is around 70%. The survival rate is around 70%. So, close follow-up to monitor the recurrence and late effects of treatment. Follow-up visits include the physical examination, imaging studies, and the blood tests. Continuously, we need to provide this physical examination and imaging studies like CT scan, X-ray, and PET scans. And they usually able to identify the further spread of disease. The frequency of follow-up visits depends on the individual risk of recurrence and the late effects. So finally, by understanding the Ewing sarcoma, we can treat the patients very effectively. In this condition, we had seen about the definition, different types of Ewing sarcoma, how we can identify this Ewing sarcoma by using the diagnostic findings, and what is the management that we can provide like chemotherapy, radiation therapy, and the surgical treatment. And finally, we had seen the nursing management, how we can assess the patient and how we will treat with using medications or by providing some psychological support to family support. Thank you.